Hello everyone, my name is Dr. Rice, and today we're going to be talking all about osteoporosis. In short, osteoporosis is basically a decrease in the overall bone density or how thick your bones are. It typically happens as one matures in age and is completely treatable if caught early enough. Osteoporosis is a big deal because if your bones get too thin, it can lead to fractures all throughout your body, particularly at the lumbar spine, your wrists, and your hips. Fractures are not fun and can be quite painful, as well as taking quite a bit of time to heal. So we would like to prevent that from happening if we can. Osteoporosis comes in two different flavors: primary and secondary osteoporosis. Primary is by far the most common type of osteoporosis that we see, and it's typically due to decreased estrogen levels as well as old age. Secondary osteoporosis is quite a bit more rare than primary, but can occur if people are taking medications such as chronic steroid use or chronic heparin use. It can also occur with other conditions such as hyperparathyroidism, vitamin D deficiency, hypogonadism in men, as well as cancer. Again, the vast majority of cases seen falls into that category of primary osteoporosis and is really not seen until individuals are over the age of 50. In order to determine if you have osteoporosis, your healthcare provider will order something called a DEXA scan. Now, I'll talk in greater detail about what a DEXA scan is in future videos, as this is a 3-part series. But essentially, a DEXA scan is a fancy x-ray that takes pictures of your lumbar spine as well as your hips, and it can determine your overall bone density. This test is really important to get, especially if you haven't gotten one already and are eligible to do so. So I would definitely encourage you to bring this up with your doctor at some point in the future. The reason that this is important is because osteoporosis is a silent progressive process. This means that you don't know you have osteoporosis until a bone breaks. And again, we don't want that to happen. If you're at a high risk of developing osteoporosis or you already have it, there are necessary lifestyle changes that should be implemented, as well as pharmacological intervention that may be warranted at that time. Again, I will go into more details about the treatment of osteoporosis in the 3rd part of this series. If you think you're at risk of developing osteoporosis, there's several things that you can do right now in order to reduce your risk of developing osteoporosis in the future. The number one most important thing you can do to reduce your overall risk of osteoporosis is to stop smoking. This reduces the chances that your bones will become thinner in the future. Secondly, it's really important to reduce excessive alcohol intake. Thirdly, and this may sound a bit counterintuitive, but it's really important that you're not underweight. Yes, I did say be careful about being too thin, because being too thin can actually lead to thinner, more brittle bones, again, increasing your chance of fractures in the future. And finally, there's a few things that you can add to your life right now that'll help decrease your risk of osteoporosis in the future. One of the most important things that you can be adding to your overall weekly regimen is to be doing weight-bearing exercises for 30 minutes at a time, 3 days a week. Weight-bearing exercises are anything that has to do with you moving your own body weight around. These can be things like golfing, swimming, walking, pickleball, etc. It's also crucial that you add more calcium and more vitamin D to your diet every single day. Stay tuned for the next part in this series where we talk about the DEXA scan as well as how to interpret your T and Z scores.